Betty recently came home after having an operation. She's been looked after by a district nurse who helps her with her surgical dressing and anticoagulant injections. She has been sent home with a urethral catheter, but she's not sure when it should be removed. Betty has not been feeling well. She is feeling sore, but she's put it down to the side effects of the operation. She's noticed her urine is dark and has started to smell, but felt she was being silly and didn't want to make a fuss. Betty was in so much pain she eventually decided to call an ambulance. It's such a private thing she felt embarrassed, but she knew something was wrong when she got a temperature. At the emergency department, the nurse finds that Betty has a catheter-associated urinary tract infection. Betty is given some antibiotics. The nurse and Betty discuss how to care for her catheter, and she's given an appointment to remove it. Harold lives in a care home. He has dementia and sometimes suffers from incontinence. Recently, he couldn't pass urine, so was given a short-term urethral catheter. Harold's catheter was left in as it meant he no longer had accidents. He has recently become unwell. He is aggressive, confused, and won't drink water. He is taken to the emergency department. Harold has been diagnosed with delirium, a catheter-associated urinary tract infection, and dehydration. He has a new catheter put in for a few days, which is removed permanently after a trial without catheter shows he can pass urine without help. Had professionals noted when Betty needed her catheter removed and monitored her after the operation, she wouldn't have got an infection, saving Betty distress and the cost of an avoidable emergency admission. Betty is much better, but her urinary tract infection could have led to more severe complications and could have been avoided if best practice had been followed. If, while Harold was still well, his catheter was removed as planned, he could have avoided the catheter-associated urinary tract infection, which can, in the worst cases, lead to death. Harold is no longer ill and much improved now the catheter has been taken out. Medically, he didn't need the catheter anymore, and it should have been removed much sooner. Catheterisation should be avoided whenever possible, particularly in older and frail people. If necessary, it should be closely monitored and removal considered as soon as possible.